and welcome to another edition of Teeth Talk.
Don't forget to subscribe to our channel. We put out new videos every Friday.
We are dental hygiene students at the Southern Ontario Dental College, and today we're going to be taking a look at a case study.
As usual, we'll be discussing concerns present in the oral cavity for this client, how they're caused, and the treatments that we would recommend.
At the end, we'll include a frequently asked questions from our furry friends to go over some common questions that we receive from clients who have these issues.
Our client today presents with gum recession and good dexterity, type 3 embrasures, a coated tongue. As well, the client has xerostomia, sensitivity, and does not perform oral cancer screenings.
Definitely some common issues that we see a lot in the office, so let's take a closer look at what all of that means and what our advice would be for this client. Let's take a look at gum recession first. So gum recession can be described as when the gums pull back from the teeth and you can start to see a lot more of the tooth, or to keep it simple, the tooth starts to look a little bit longer. Generally, this is caused from improper brushing techniques and poor oral hygiene habits. So for the modified Stillman technique, we want to take the bristles of your toothbrush and place them partly on the gums and partly on the tooth, coming in at about 45 degrees. So we don't want those bristles coming in flat against the teeth and the gums. It's also really important here that we do have some of the toothbrush on the gums and that we're not shoving those bristles into the gum line. So once we're in proper position, we're going to brush each tooth one by one, making short back and forth vibratory strokes. Perfect. So once those strokes are complete, we are going to roll that toothbrush away from the gums towards the crown of your tooth. And we are going to move on to the next tooth, repeating the same process. So we are going to make sure that you brush both the cheek side and the inside of your mouth for 2 minutes each time.
Okay, so now we're going to be looking at a type 3 embrasure. An embrasure is when the gums or papillae in between the teeth starts to recede and you get a larger and wider space between the teeth. Type 3 embrasures specifically is considered a 75% loss of the papillae in between the teeth. What we'd recommend for this type of issue is an interproximal brush for flossing. This is the type of brush that's most effective for interdental cleaning for type 3 embrasures. You can use it from either the cheek side or the tongue side. And it's okay if the bristles are a little bit larger than the space that you have. We'll talk about what different brushes look like a little bit later, but the most effective ones are the cylinder shaped, which is what we have here. Now, let's take a look at how you use it in the mouth. So the method for using this type of brush is to insert the brush at 90 degrees and move the brush slowly in and out of the space from cheek to tongue side or vice versa, making sure to rinse the bristles in between each space and after each use.
The next oral cavity issue for this client is their coated tongue. So as we can see here on the left, that's what a healthy tongue should look like. And on the right, that is an example of a coated tongue. So what we mean by coated is that the papillae of the tongue harbors bacteria because petrified food can get stuck there and it starts to produce gases that can lead to bad breath. The best treatment for a coated tongue is using a tongue cleaner. This helps remove debris from the back of the tongue surface. There are a few different tools that can help you with this, and again, we'll take a look at some different ones in a bit, but generally how you would use a tongue cleaner is starting at the back of the tongue and dragging it forwards towards the tip. Rinse the scraper in between with water and repeat until the tongue is clean, making sure to use overlapping strokes.
Now we're going to be talking about xerostomia. So xerostomia is essentially a big word for dry mouth. There are several causes for xerostomia, which can include stress, medications, lifestyle choices like smoking and alcohol, as well as side effects from some diseases. Xerostomia clients are at a higher risk for developing cavities. In order to treat xerostomia, it can be treated with medications. You can also use saliva replacement rinses, sprays, toothpastes, and gels, or any saliva-stimulating product. Since xerostomia clients are more prone to developing cavities, it would be important to implement preventive measures. These preventive measures may include fluoride substitutes and xylitol.
The next issue for this client is sensitivity. So sensitive teeth are typically the result of worn tooth enamel or exposed tooth roots. Sometimes, however, tooth discomfort is caused by other factors, such as a cavity, a cracked or chipped tooth, a worn filling, or gum disease. We're definitely not surprised that our client has tooth sensitivity due to the recession and the embrasure spaces that are present. Generally, in order to treat sensitivity, the product being used will act as a plug or a coating over top of the area causing the sensitivity. We call these dental tubules. The most common treatment for sensitivity would be using a toothpaste with very specific ingredients that are designed to plug these holes. Ingredients to look for in the toothpaste are novomin, stannous fluoride, sodium fluoride, and arginine and calcium carbonate. These are really big terms, but we're going to show you some examples of different products that you can look for in your local drugstore. One thing to note, these products require consistent application, which can be achieved by brushing twice daily with any of the products we cover.
Okay, so now we're going to talk about oral cancer screening. So oral cancer is easily overlooked as it's usually asymptomatic at early onset. The public is generally unaware of the risks associated with oral cancer, and hygienists should be doing an oral cancer screening at every single one of your appointments, and in between they should be doing it at home by themselves in between appointments. Now we're going to take a look at our examples. So Sarah and Charlie are going to be doing an example of an oral cancer screening today, so let's have a look. Okay, so here we have Sarah and Charlie. Thank you for being our examples. So we're going to start with an extraoral examination. So we're going to do a visual inspection of the head, face, neck, and ears for asymmetry, swelling, dry or crusty lesions, and color change. Perfect. Now we're going to take a look at the lymph nodes. So we're going to palpate the lymph nodes and note change in size, consistency, and mobility. Okay, now let's take a look at the lips. So we're going to observe the lips, closed and open, and we're going to note changes in color, texture, and any lesions. All right, and now we have the labial mucosa. So we're going to assess the labial mucosa for color, texture, and swelling. Awesome. And now we have the buccal mucosa. So we're going to go inside and we're going to examine and palpate the buccal mucosa. He's doing so good. Now we're going to take a look at his gingiva. We're going to examine and palpate the gingiva. Okay, now we're going to take a look at his tongue. So we're going to observe the tongue for changes in size, ulcerations, coating, papillae, color, and texture. We're going to grasp the tip of the tongue with a gauze, if we're able to. And we're going to palpate the sublingual area with our fingertips and opposite hand extraorally under the chin. Amazing. All right, now we're going to take a look at the floor of the mouth. So we're going to have the client lift their tongue, inspect the floor of the mouth for change in color, texture, swelling, and ulceration. We're going to palpate the sublingual area with fingertips and opposite hand extraorally under the chin. Okay. Now we're going to palpate. So we're going to have the client tilt their head back to observe the hard and soft palate. We're going to use our mirror, if we had one. Oh, he's doing so good. We're going to use it and we're going to examine the oral pharynx and the anterior and posterior pillars. We're going to look for change in color, texture, swellings, and ulceration. And we're going to palpate the hard palate. We're going to be careful not to trigger a reflex. Perfect. He did so good.
Good boy. Thank you.
Okay, so before we do our Furry Friend FAQ, we're going to be taking a look at some of the products that we had mentioned today so you guys can have a look at what they look like and some prices associated with them too.
All right, let's go. So we wanted to check out some of the products that we were talking about in the video. So we took a quick little walk downtown to the drugstore in order to see what they had available. Paris is so pretty in the fall. I only found one tongue cleaner, but it's the one that we showed in the video, and this one was $5.79. Also, we wanted to show some examples of some different electric toothbrushes that are available. We didn't talk about this in the video, but a gold standard for brushing for this client would to be an electric toothbrush instead of a manual toothbrush. To treat sensitivity, we found a couple different toothpastes. The first one here is Sensodyne, and it was on sale for $6.99. And then the second one that we have here is the Colgate Pro Relief for sensitive, and its regular price was $8.29. We also found Preventive for sensitive teeth, which is from Colgate, for $19.49, and the Preventive 5000 Plus with increased fluoride was $16.99. We found a couple different interdental aids that we used in the video, and as you can see, there are some different sizes. Their price was $8.29. And some additional ones here, we've got soft picks that were $10.49, and then we've got some smaller interdental aids here and they were on sale for $3.79. For dry mouth, we found a Biotin mouthwash, and that was $26.99. There was also a different size that was on sale for $12.99. Right beside it is a moisturizing spray for $12.99, and then we also found a fluoride toothpaste for $16.99. There was this gum that was pretty cool, and we found that for $10.99.
Okay, great question, Zoe. That's actually a question that we get very frequently here in the office. So when you have recession present in your mouth, what we're doing now is these measures that are going to be taken from it progressing any further. So we can't grow new gums back. We're just going to arrest it at the point that it is right now.
So that's a great question, Charlie. Technically, to clean your tongue, you can use your toothbrush, but the majority of the time, the toothbrush misses the posterior 1/3 of your tongue. So the very back of your tongue. As well, tongue cleaners are a lot less likely to trigger your gag reflex, so it's a lot easier for the client to actually use.
So that's another great question. With a type 3 embrasure like the client has, the floss isn't big enough to get in between those embrasure spaces. You need something a little bit bigger like a proxy brush to get in between. That's why it has like the bristles on it and everything like that, because there is a 75% loss, attachment loss of the papilla in between those spaces. So you do need something a little bit bigger.
Okay, so that's a really great point. I understand that not all of our clients have those high risks that are associated with oral cancer. That doesn't mean that you shouldn't be performing oral cancer screening. So one of the big causes of oral cancer that we didn't mention is actually the HPV virus, which has been on the rise over the last few years. So that can be a cause of oral cancer in the mouth. As well, the most common cause or the most common type of oral cancer is squamous cell carcinoma. So that would be very similar to the skin cancers that you get on your arms, on your legs, anywhere that you have skin. Because it's really important to remember that oral cancer can show up on your lips and your cheeks, which are that epithelial tissue, and not just on your tongue or your gums. So one other thing we want to discuss today is some disadvantages of all of these products. So everything that we discussed in our videos are obviously a really big advantage for this client in order to stop the progression of all of these issues.
Okay, so some disadvantages could be cost associated with all these new products that we are recommending. In our video, we did use a manual toothbrush, but the gold standard for brushing is an electric toothbrush, so that could be an additional cost as well.
One of the other things that we need to consider is time. So depending on how much time this person is dedicating each time they brush their teeth and how much time they have to use different products, that will be something else that we need to consider, because implementing all these different things is going to take a lot more time than just simply brushing their teeth.
And the last thing is breaking bad habits. So it's going to be a lot of information that we're going to be implementing with the patient. And then it's just breaking old habits that they've been using and implementing the proper habits, brushing techniques, everything like that. Okay guys, thanks for coming along with us today and looking at one of our client case studies and then answering some of the frequently asked questions from our furry friends.
Make sure to tune in next Friday when we've got a new case study on a new episode of Teeth Talk.
Like and subscribe.
Come on guys, we're done.